Good evening and a very warm welcome to all our Satsang family members from the School of Ancient Wisdom. So, welcome to another Satsang of the Spiral of Wisdom. It's been started by Ma Manize, the founder of the School of Ancient Wisdom. So, today we're going to be having our esteemed guest, Pooja ji, who will be presenting the Satsang. So, before that, I would request Swati to start off with the school prayer.
Good evening, everyone. O hidden life, vibrant in every atom. O hidden light, shining in every creature. O hidden love, embracing all in oneness. May each who feels himself as one with thee know he is also one with every other. Thank you.
Thank you, Swati. So, for those who don't know me, my name is Ramesh RK. I've been in the school for quite a while, and I'll be hosting this satsang today on behalf of the School of Ancient Wisdom. So, to introduce our esteemed speaker today, Pooja ji, I'll just give you a brief intro. Pooja ji is a seasoned finance professional with a background in CPA and MBA, and made a profound shift towards holistic wellness, founding Inner Saga, a medical yoga and healing center in Bangalore. With 16 years of corporate experience, including roles of prestigious companies like Deutsche Bank and GE Capital, Pooja transitioned into the world of medical yoga and healing a decade ago. Mentored by renowned experts such as Dr. Deepak Sachdeva, Dr. Vinita Ketkar, and Dr. Niru Kumar, Pooja advocates for the accessibility of yoga to people of all ages and stages of life. Her mission is to dispel misconceptions surrounding yoga and showcase its transformative potential for addressing early age pains and diseases prevalent in today's lifestyle. Pooja believes that yoga is not limited by physical constraints and encourages everyone to embrace it as a holistic practice for enhancing overall well-being. Through Inner Saga, she endeavors to inspire individuals to integrate yoga into their daily lives, recognizing its profound impact on both small and significant aspects of life. So, the topic for today's satsang is medical yoga, and it sounds very interesting. So, without much more ado, over to you, Pooja ji.
Thank you. Thank you, everybody. It was a very, very beautiful summary of my career. Thank you for putting it in that way. As you know that I'm Pooja. I have been in Bangalore for past 4 years now. Earlier, I was in Pune. I'm originally from Delhi and I moved here from Pune 4 years back. So in Bangalore, my experience has been that medical yoga, nobody knows about it. Whenever I get inquiries through Google My Business, they ask me what is special about this yoga. And I really have hard time explaining them because nobody knows here what it is. They are used to power yoga and other forms of yoga, aerial, acro, but not medical yoga. So I'm really grateful to the school for giving me this platform where I can spread this awareness about medical yoga and how it is practiced. I will also invite every one of you to ask me as many questions as you can, because the more questions you ask, we can dig down deeper and develop a better understanding. I have tried to put it through in the presentation, but if we will engage and ask questions and share our curiosity about the topic, it will be very helpful. So I'll share the presentation now. Just give me a moment. Okay. So is it visible now? Okay. Yeah. All right. So medical yoga, an approach of modern medicine combined with medical yoga. So what is medical yoga? Anything that comes to your mind, you can take a minute to type in or just unmute and say something, whatever comes to your mind, anything.
Yoga specifically oriented towards healing, something medicinal. That's the first thing that comes to mind.
Yeah, as the word says, obviously that comes to our mind. Somebody has also written in the chat, to cure and heal illnesses. Yeah, certainly. So yes, it is that, to heal illnesses. So to be precise, medical yoga is a yoga sequence designed for you as per your current medical condition. So if your current medical condition is very good, no pains, nothing, no problems, your sequence will be accordingly. And if your current medical condition is challenging, like you have joint pains or any lifestyle disorders, BP, diabetes, then your yogic sequence will be in accordance to that aspect. So here it is not one fit all. Medical yoga is an individualized sequence for everybody who comes to us. Now, how does it happen? First of all, we have to, why this is not moving? This therapy originated in Pune. You all must have heard about BKS Iyengar Guruji. Popularly, he's popular for Iyengar Yoga. So Iyengar Guruji started yoga with props. Now he had a disciple. His name was Dr. S.V. Karandikar. He was a medical practitioner, MBBS. He gave a medical angle to yoga with props, to Iyengar Yoga, and he developed Sanjeevan Yoga, which is practiced in Pune. You can see the image. And then with further enhancement and further additions, now it has been transformed into medical yoga. So in Pune, almost everybody knows about it, and we are trying our best to spread it to Bangalore as well. So it begins with a consultation. There is a consultation between the therapist and the client, and the therapist, who is trained in anatomy and physiology, he tries to take your medical history. If you have had any fractures, sometimes we have fracture in very young age and we forget. Now at the age of 40, you come to join a yoga session and you've forgotten about a fracture which happened 10 years back or 15 years back. It is important to discuss that, because while doing the asanas, that part might be tender now as well. So the therapist takes the history and the present situation in his mind, and he does the physical examination. We will observe the posture, the walk, the way you sit, the way you walk, your current flexibility level. We measure the angle at which you can raise your leg so that we know where to start with. So if you're able to raise your leg at 50 degree, we cannot start with Uttanasana. We cannot ask you to touch your toes. All these aspects are taken care of. If you are a BP patient, you definitely are not allowed to do Kapalbhati in the initial stages or Bhastika. We have to refrain from doing that. So these kind of things are taken into account. Even the family history is taken into account. And if the client is willing to share, emotional situation is also taken into account. If you're going through a work-related stress, many people come here with the problem of insomnia. We can't sleep. We go to bed at 12, we keep tossing in the bed, but we can't sleep. So all these things are taken into account, and according to that, their sequence is designed. Rope and belt therapy. This therapy is an integral part. It works specifically on the joint pain relief. Sciatica, frozen shoulder, knee arthritis, any kind of back pain, any kind of neck pain, cervical spondylosis, all these things are taken care of by the rope and belt therapy, and it is a part of medical yoga. We do the normal asanas, Hatha Yoga asanas, but those asanas are modified. As you saw in the picture, even in this picture, this asana is modified with the lot of bolsters, bricks, and ropes. So these asanas are modified so that you can gradually progress and the asana is safe for you. And you can hold the position for a longer duration. That makes it meditative. When you are holding an asana for more than a minute, for 2 minutes, for 5 minutes, for 10 minutes, you are with yourself, with your breath, and in the asana, which automatically makes it meditative. And as I said that the session is based on individual history, sessions are totally individualized. Even if there are 4 to 5 people in the session, everyone does what is prescribed for them. You don't have to match anyone's speeds, anyone's flexibility level, or anyone's sequence. You have your own timeline, your own slot, and your own sequence, which will help you to achieve your expected results. Yeah. So this is a brief about medical yoga. So as everyone said that it is there to heal illnesses, this is obviously the first word that comes in mind. So the question is it only for patients? Do I need to be a patient to join medical yoga? A very big absolute no. It is recommended for everybody. I'll give you my example. In my late 20s, I was a badminton player and I used to exercise in park, jogging, running, jumping, all sort of cardio, high intensity, because that was the only way I knew to sweat. I used to work in office. There is no energy went out in office. And then after coming back home, you need some went out, you need to exercise, you need to sweat and take everything out. And slowly I started developing tenderness in knee while climbing stairs, getting down and sitting, standing. I started developing that. That's when I came to know about Dr. Deepak. I went to him and said that, sir, I'm just 28 years old and I'm developing knee pain. I'm very scared that what if I develop arthritis at an early stage? He started laughing. He said, as I said that history is taken, he asked me, what are you doing at present? What is your workout? What you have been doing? I told him everything. There I got to know the word overuse. He said that you have overused your knees. You are jumping, you're running, you're doing spot jogging and high intensity, everything. Your knee will pain. What do you expect? So when I understood that concept, that was the time there was no looking back. In 2009, I joined medical yoga with him. And till today, I have never looked back. I have never felt the need to sweat and run to feel energized and for a vent out. It is a choice now. It is not a compulsion. I can feel energized by stretching, by relaxing, by doing meditative positions, by doing rigorous breathing, or just sitting with myself. Now I have a choice. I have many ways to experience that. Earlier, it was a compulsion, run and sweat, cardio. So it has benefited me, and I really wish that everybody who has a misconception should drop it and come to medical yoga. This is my favorite, breaking misconceptions. Just let's take a few seconds to look at the pictures. Nowadays, a lot of these pictures are available on Instagram. So what is happening these days, even if you Google, there is a concept of basic asanas, intermediate, advanced asanas. And classes are also tagged like that. So what is happening, those who do basic asanas and are not able to go to intermediate asanas or the advanced asana, they start feeling low about themselves. I am not good enough. Oh my God, he's such a beautiful yoga teacher. They do so well. I can't do that. I can't do this. Lot of comparisons and evaluations are coming in. This mindset really needs to change. We have enough competition in our life. We don't need to bring competition in yoga. We really have enough on our plate. So we do what is needed. The effect which this middle picture of Adho Mukha Svanasana can give you for your spine elongation cannot be done in Ashtavakrasana in the first picture. No way. The effect that cat and cow can give you for your lumbar spine opening, for your lower back opening, for your back pain relaxation, and for your breath, it can never happen in the first position. So how is it advanced? And why are these two basic? We have to drop this segregation because it is also holding people from joining yoga classes because they fear that what if we have to go to the advanced level? So we do what is needed. Today, if I am tired of traveling, I will do what is needed to relax. Today, if I have been lethargic for the past 8 hours, I will do what is needed to energize myself. Today, if I'm not able to sleep, I will do what is required for me to have a better sleep. If at all, there has to be a category, we can make, okay, spinal rotations, knee strengthening exercises, sitting exercises, balancing positions, spine strengthening positions. These categories are acceptable. There is no competition here. But basic, intermediate, advanced, no. Also, there are many other misconceptions due to which people don't join yoga sessions. I am not flexible. This is like super famous. I am not flexible. I can't do. I have not done yoga before. Postures are too fancy and difficult. This is all Instagram. It is slow and boring, not challenging. I feel lost in the class when my trainer can do the postures and I can't. I keep looking here and there. Others can do. I can't. I keep skipping positions which I can't do. I already have back pain, knee pain. I have been advised not to do forward bends. For the back pain patients, we treat them with forward bends. That is the beauty of it. So all these people who feel restricted because of these misconceptions, medical yoga is the starting point from them as it gives you a safe and confident environment. You are not watching anybody. You have your own sequence to follow, your own regime to follow. I'll take a pause here. Okay, after this slide, maybe we can take a pause. So if we at all have to make a category of basic and advanced, I'll just remind you of 8 limbs of Ashtanga Yoga. Just look at this picture. What people think is advanced yoga and what advanced yoga really is. The 8 limbs, the later stages of 8 limbs of Ashtanga Yoga is Dharana, Dhyan, Samadhi. It is not asanas. So if at all we aspire to go to the advanced stage, that is where we have to reach. Asanas are only a checkpost to the path to the destination. Before starting to talk about rope and bell therapy, I can take a pause. If you have any questions, you can ask me. I'm happy to take questions at this stage, and I will try to cover it up in the rope and bell therapy if there are any questions.
Sure. Can I ask one?
Yes, please.
Yeah. So obviously, you have worked with sports people before. So are sports people benefited from this type of yoga immensely?
Yes. So I get people who are footballers. I have already dealt with people who are footballers and marathoners. So what happens? They have a very limited workout. All of them do workout before starting the game, but their stretches are for 10 seconds, 15 seconds max. Their hamstrings are still tight. And they come to me with injuries of hamstring stretch, tendinitis, because hamstrings, they were trying to stretch and hamstrings have been stretched beyond limits. So these kind of patients are really benefited when we do the stretching slow and steady pace. They can feel a lot of change. Their balance improved during the game. Their flexibility improved during the game when they have to sprint or run. Also with chondromalacia, patients with chondromalacia, that is called the runner's knee. The athletes have this problem. Their patella is, their kneecap is slightly tilted because they are not been working on their inner thighs.
And
So,
also there are a lot of patients with older people with the cervical related C1, C2 up to 6, and then the lower
yes,
back. It's a very common problem these days because of
of
the
course.
phone and also assignments or stress, right? You treat those type of things also without any invasive surgery and stuff like
Yes, of course. And in fact, sir, I should tell you that you don't need to be old to have neck pain these days.
Yeah.
So I've recorded a video in which I have shown how we tie the belts, and I will take it in the rope and belt therapy. The belts are tied in a way to keep your shoulders retracted because slouching is the main reason. And why we slouch? Because muscles are weak. So first target is to put the shoulders behind, open up the muscles and then strengthen them. Strengthening is done when the alignment is correct.
Thank you.
The teachers, beauticians, IT software people, all of these, they have neck pain problem. Shall we move ahead?
Yes, please.
Okay. So we'll discuss. Yeah.
Yeah, I had a question. I know that during yoga, when we do yoga, many of us are not flexible enough for different asanas, and different people have difficulties in different types of asanas. Some
Yeah.
people might be able to do twisting asanas very well. Some people may be able to do Padmasana, but not the twisting asana, and so on.
Yes, exactly.
So, what I can make out when I see your props, whatever you have over here, the belt, etc. These are things I, in fact, have asked my yoga master for. Can we have props here? Because, for example, I'm not able to do Padmasana properly, or even the asanas where you are required to spread your legs wide. That is one weak area. So when I look at these belts, it looks like these are all props that basically support you to achieve that asana without the extra stress that the body goes through when it's not
Yes.
flexible enough. So is that the approach that you use to
Yes.
ease a person into the asana of their weakness?
Yes, absolutely. So that is also part of Iyengar yoga.
Okay.
That is the part of Iyengar yoga, and we practice same thing here. And it has been further enhanced into rope and belt therapy, which particularly heals the joint pain. So to answer your question, let's say if you are trying to do the split legs.
Right.
So it has to be done with support earlier. Otherwise, hamstrings are really, really very tender. So if you try to stretch a lot, you will start developing a pain on the inner side of the knee.
Right.
Okay, because
Okay.
of overstretching. So it has to be relaxed, and probably you need to do Mandukasana or other hip openers to first relax your inner thigh muscles in a steady way and then attempt the split. So to achieve one asana, sometimes you have to take help of other asanas which are not so intense in nature and which are slightly gentle on the muscles, and then you should attempt other asanas. The Mandukasanas is a tadpole pose that you must have seen.
Yes.
The legs are open in the tadpole shape, and slowly you try to spread it. You can try Baddha Konasana first. It also works on your inner thigh.
Right.
So after having worked through these asanas, you can attempt again. Then, okay, certain level is achieved, then you attempt again after some time. This is how we progress, and you can measure the length up to which you're going down.
Thank you.
Yeah. So I'll proceed further.
Yes, please.
Yeah. We'll discuss a bit more about rope and bell therapy. Recipe for joint pain. Overuse, less use, and misuse. So what is being overused or less used or misused here? The muscles. We overuse our muscles or we don't use them at all. Full day sitting job, less use of muscles. Running, what I was doing, running, spot jogging, jumping, cardio, high intensity, overuse. Sitting in front of television or watching video on mobile in a wrong position, misuse. So what happens? How it causes pain? Sir, Vishwanath sir, could you please mute your laptop, please?
Sure.
Thank you. Yeah, so muscles are either tired, exhausted, or dried up, or wasted. There is only a limited capacity that we can handle. So what are the other examples of overuse that you can think of? How do we do it? Example, I don't even go for a walk for 5 minutes. Now I will go for a trek, full day trek, climbing boulders and to whatever height. I will continuously trek for 14 hours. What is it? Overuse. I don't move for 5 minutes also, and now I am doing it for 14 hours. And I continue doing it. I have exceeded my capacity for which I have trained my muscles. Less use, not moving at all. Sitting on the chair, sitting on bed, sitting in front of TV, sitting in car, cab, then again sitting in office, less use. Your spine is not getting rotated, your hamstrings are not getting stretched, calves are not stretched, muscles will become stiff. Body has a simple funda. If you don't use it, lose it. There is no concept of hoarding in body. Like we hoard things in our house, in body, nothing is hoarded. You don't use muscles, you will lose it. You don't work out, you will lose vitamin B12, vitamin D, calcium. So there is no hoarding. Whatever you use, body will reserve that. Whatever you don't use, it will be excreted out. So less use will obviously result in many deficiencies as well. Overuse will result in wasting of muscles. Misuse will result in all sort of joint pains. So all these things are understood when you come for consultation. We will try to know your routine, what you're doing, how you're walking. Many people walk like this. They keep their feet like this outward. They don't keep it straight. As a result, their lateral muscles are totally tight. You won't imagine if we just ask them to walk straight, they start feeling better. Just this must change. So how rope and bell therapy works? You can see here, these are the pictures for rope and bell therapy for knee arthritis, especially for older people. Knee arthritis till today also generally doesn't happen in young age. It happens in old age. So these ropes are tied in a way to correct the alignment. Here, this person is trying to stretch the hamstrings. Here also, we are trying to correct the alignment. And in this, we are trying to strengthen their legs. So how alignment happens? Poor posture, poor alignment. This is the knee joint. If it is misaligned, it will start rubbing the cartilage from one side. This is how you're walking. So if the posture is corrected and traction is given, gap is created, your knee cartilage will stop rubbing. It will rub less and it will help you to reduce pain. It will slow down the degeneration process. And when we move to the strengthening part, When we have created the gap in the structure, we also have to plaster it to hold it firm. Then we work on the strength part. All the therapies that happen here works on posture correction, alignment of the frame, and then slowing down the degeneration process, correcting lifestyle. If you are eating gastric or acidic food, you will have joint pain. It will be aggravated for sure. So all these changes are suggested. A timeline is discussed that if you have come with third grade knee arthritis, then what will be the timeline and what percentage of relief we can give you. So you asked about cervical. This is for cervical spondylosis. You can see how the belts are tied up. And the second picture is of the traction, in which shoulders are retracted and pulled down because they have added weight to the neck. And this position are held for 7 to 10 minutes. And this is totally non-invasive. We are purely working on posture correction and alignment of the joint. These are the pictures for lumbar spondylosis, specifically this second and third picture. This is for the sciatica stretch. When there is a nerve impingement and you have a tingling pain going down your leg, radiating pain, this is specifically for that sciatica effect. Other things that can be helped with are prolapsed disc, herniated disc, numbness, tingling in legs, simple tenderness in lower back, pain due to long standing, long walking, sitting in cab for long hours, traffic, all these things can be handled through medical yoga and rope and belt therapy. So basically it is your joint pains are not a showstopper. They are not a showstopper at all. These are some anti-aging meditative postures. The first one is Suptavirasana, second one is Viparit Dandasana. These are also from Iyengar Yoga. There are other, this is also part of restorative yoga, and these are held for a very long duration. You can hold them from 5 to 15 minutes, 20 minutes. Super comfortable, no stress, posture is totally passive. You can relax. You can just imagine the chest opening in the Viparit Dandasana. Whole rib cage is expanded and very deep breath is going in. Excellent posture for migraine, for insomnia, anxiety, your cardiac health, asthma. 100% benefit for asthma because it is really opening up your rib cage and increasing your lung capacity. You are having deep breaths for 10 minutes, which we don't do. Most of us have shallow breathing. It helps diabetes, blood pressure, and any other lifestyle problems if you may have. These things can be easily arranged at home also. You can get a bolster made, a pillow made. You come here, learn it, how to do it, and you do it at home. You come back tired from work, just put a bolster and pillow and go off in the asana. Okay, and now I'll show you some examples of the video. This is, okay. Can you all see?
The video is not opened yet.
Okay, just a minute. I think I'll have to share.
So when you share, at the bottom, there's an option called share sound. So if you just click on it, it will share along with the sound.
Okay. Now? Now, were you able to listen
Video
to
is
the...
visible, but audio is not.
Okay, share sound. Yeah, I found it.
Not really a disbulge situation because she's into IT profession and a lot of work is being done on the laptop. So it's not really a disbulge situation, but she has tender shoulders and her neck tends to pain very easily if she has to work for 1 hour or 2 hours at a stretch. She needs something that can support her at home. So we have these belts, which are medical yoga belts, and we have used an extension to this belt as we will need a longer belt. So I am telling her how to tie this belt. First of all, I will tie this and she can also make a video and her husband can do it for her when she needs support. This belt can be tied for 2 to 3 hours comfortably, and while she is working, it will give her a lot of relief.
We can skip the...
This will help in giving lot of support to the shoulders, and when you have tendency to slouch while working, this will keep your shoulders behind. It has to be tied in a particular manner at a particular angle so that it can and tighten enough so that shoulders stay behind. If it will not be tight enough, then you will again, since you have a habit of slouching, you will again slouch along with the belt. These things which form a support system at the house can be easily learned and someone in the family can help you do it. This is her posture. This will help in keeping the shoulders retracted instead of slouching.
Well, so this was cervical spondylosis. I want to share one more video, which is an example of, just a minute, how we modify Surya Namaskar. Everybody wants to do Surya
I never
Namaskar.
want you to drop your
How we modify Surya Namaskar for those who cannot...
spine and hang like this.
Okay,
Because
can you see?
Yes.
Okay. So she has a problem going for her toes when she bends. So we don't allow such people to hang. Okay, they have to go down with support.
like this. Okay, but we still have to do Surya Namaskar, and I'll show you how to modify. You take your arms up in Uttanasana. Inhale, hold your breath, bend your knees a little and come down. So you don't come straight, okay? If you come straight, then there is little risk to the spine. Just bend your knees little and come down. If from this level you can go down, then you slowly take your hands down. If you cannot, just stay here and bend your elbows and do Uttanasana. After taking this stretch, we go to the second position, Virasana. From the bench, you take your hands down. And then we do Adho Mukha Svanasana. For coming back, you again come back in the same position. Put your hands here, take full support. Lift your hip up, okay? Come back, bend your knee and slowly come up in Tadasana. So this will help. We can still practice. Let's try. Bend your don't lift your heels. Bend your knees. Yes. Go down. Good. Now straighten your knees. Yeah. Bend your elbows. Go to the second position in Virasana. Right. Touch your knee should be at 90 degree. Stretch your back foot. Yeah. Now go in Adho Mukha Svanasana. Hands down. One hand down, second hand down. Adho Mukha Svanasana. Yeah. Good. Hips up, chest down. Heels down. Okay. Good. Now bring your same leg back. Same leg from which you started. 90 degree. 90 degree. Bring it to the front. Yeah. And bend your back, head up. Now put one hand here, another hand, kick, come back. So little bit of fine tuning is there. When you are going in Virasana, it has to be at 90 degree. If you are at this angle, your knee cartilage is totally compressed. So you keep it at 90 degree and stretch.
So we are back. How do I start seeing the participants again?
Swati,
Sorry, I didn't get you.
she was
I
asking.
want to, okay, I think I found it. Yeah. All right. So I hope the videos were clear enough and it gave you some insight of how it is done.
Spine and hand like.
Yes.
So yoga is like food and water. We don't make any excuse to eat or drink. We eat sometimes 3 times. Nowadays, people are taking smaller meals at 6 times also. It is not only to be used as medicine. We have made medicine. When you fall ill, you have joint pains, and then people start coming for yoga. When they start having bad health, why not treat it like food and water? Every day, you just spend 10 minutes eating, finishing your meal. You spend 10 minutes doing yoga. Little bit of asanas. 2 asanas, 3 asanas per day. That's all I'm requesting. But please treat it like food and water. Some days we fast, we eat khichdi, pongal, and some days we have heavy meals. So some days you do more exercises, some days less exercises. That's all. But please incorporate little bit of it every day. It is as important as food and water. Let's not make it a 5-day course of antibiotics or any medicine to be taken in illness. So an ending note from my side, a request also. Let's not drop yoga practice because it has been glamorized or it feels inaccessible due to other limitations like joint pains or health conditions. Because the target is unachievable, like 108 Surya Namaskar is done in the class. How will I do it? Daily sitting for 45 minutes, my legs go numb. I can't do it. Sit for 5 minutes. Okay, 1 minute. Just 1 minute. But do it. 1 minute is also as much yoga as 45 minutes. It does not make it more or less. It's equal, absolutely equal. Body is designed to last for more than 100 years. That is the lifespan of human life that we used to study in school. It is designed to be that way. So let's make it happen, even if we got 5 minutes to ourselves, and it's possible. Stop measuring and stop comparing. That's all from my side, and I'm happy to take any questions that you may have.
Thank you, Pooja ji. So if anybody has any questions, please do open up. And
I have some questions.
please.
Thank you. I wanted to ask you, some phone numbers, whether one can share your number with some of the people that I know, and the Pune number also, because I know people in Pune. That's the first question.
Okay, so can I type it in the chat box?
Sure, ma'am.
Okay.
Yes, please.
So
Yes.
first of all, Pune, that's the origin. Kabir Bagh, Kabir Bagh in Pune, and Genosis Medical Yoga Center. These are in Pune. So you can Google them and take an appointment. Kabir Bagh is the institute where Karandikar sir started everything. It is a very big institute. They handle 200 patients. And Genosis Medical Yoga Center is set up by Dr. Vinita Ketkar, who was teaching in Kabir Bagh. She has set up Genosis Medical Yoga Center. It is a smaller space, but quality is equally well. I have also studied from her. My number, it is Inner Saga. I work in a very small setup because as people are not aware about medical yoga, it is difficult to find a team also here because usually the focus is on power yoga. Here, yoga trainers are not very well versed in anatomy and physiology. So I handle all the cases myself. So it's still an individualized work done by me in Bangalore.
We
Oh,
have
you
a
want to
question.
learn?
Yes.
You can contact Genosis Medical Yoga Center. They run courses. I have not yet started doing courses. So they run courses both online and offline. But they require you to have a prior knowledge of yoga. So first you will have to do a normal YTT, which is yoga teacher training, and then medical yoga teacher training.
How long does it take to do the normal and
Total 8 months minimum.
for both normal and medical?
Yes, minimum 8 months.
Okay.
I have another question, ma'am. In terms of physiotherapist, a lot of people go to physiotherapist as an alternative. In your experience, how does that compare with medical yoga?
Okay, so in physiotherapy, the IFT and ultrasonic help in acute situation. I have still not kept those machines at my center. In the Delhi center, they have those machines. So in the acute situation, those machines are really helpful, especially in case of sciatica. Yoga cannot be started in acute situation. The pain has to settle down, and then only it can be started. Because you cannot stretch a painful part. It will pain more. Also, the physiotherapy will not take care of your emotional aspect, the breathing aspect. And what my experience with physiotherapy is, they hold the asanas only for 5 to 10 seconds. Here we hold the asana minimum for one minute. The hamstring stretch you saw where the leg is tied with a belt, that asana is held minimum for 1 minute. When we hold asanas for such a long time, the muscle gains length. If you stretch a rubber and put it on a large packet, it gains length. Same is with the muscle. So when you hold them for 1 minute, 2 minutes, it gains length. That is not achieved in 10 seconds. When I gave you an example of the footballer, they are also doing stretching for 10 seconds. Here when we do the knee strengthening exercises, we track the progress, not 10 counts. 10 counts, 20 counts, you have to take it to minimum 75 seconds. That is the target which is set. So that kind of stamina which is built up in quadriceps, then we know that your legs are strong enough. So physiotherapy sessions usually last for 7 days. They don't focus on breath, emotions, your food, lifestyle changes, posture correction. They will not record your walk and tell you this, your foot is out, you have to take it in. Your one hip is down, one shoulder is down, one hip is down. That's why there is abnormality. They don't do these things. So normal course of action that we take is first we go to the orthopedic, we take painkillers and analgesic, and then they refer you to physiotherapist. He will give you some exercises. It works. I'm not saying it doesn't work, but it is little incomplete. We need to enhance it.
Thank you, ma'am.
Thank you. There's a question, what asanas to do for knee strengthening? It's very difficult to cover that in this presentation.
There's another part of the question where Vijayji has asked, where can he learn medical yoga in Bangalore, I presume?
In Bangalore, no, there's nobody. There is nobody.
So, Poojaji, are you located here in Bangalore?
Yes, I'm in Sahakar Nagar, in between Hebbal and Yelahanka.
So, do you conduct any such programs from your end?
Conduct as in teaching?
Yes.
No, teaching, I have not started. I'm actually like just handling patients is too much. So developing a team to teach anatomy, physiology, rope and bell therapy, not possible.
Not yet. Oh, I see. Well, from what I gather, of course, I mean, it's very nice that you have given a structure to this. I do know that some of the other yoga schools, they do some aspect of what you've shown with belts and other props.
That must be Iyengar yoga.
Yeah, or even
Yeah.
SSY, SVyasa, sorry.
SVyasa, yes.
The Yoga Kendra, they have a research center as well. But nobody's really passionate like this and so clear in their, I mean, nobody that I have come across, not that I'm an expert in this, but I think it's got fantastic potential. I mean, I'm just sharing in response to what I've heard so far. It's got fantastic potential because this is one way of making yoga easy for people. And even if we were to introduce this, even in schools and other institutions, even in software companies, for example, I'm sure it'll go a long way because there are many people, thanks to our sedentary and non-physical lifestyles, who have lost flexibility in different parts of our bodies. And when you go to asanas, even me, the hamstring, I've been on and off doing yoga for many years, but the hamstring loosening hasn't really happened. So that could be a breakthrough actually with these products. And it would be wonderful if we have something here in Bangalore, because Bangalore is a place where probably has one of the highest number of spiritual and wellness seekers.
Of course. Totally agree with you.
It's the fruits are ripe for the picking.
Yeah, in fact, it is so easy. People who come with cervical problem to me, I tell them 5 or 6 positions that can be done in a washroom cabin as well. But please do it. Please don't end up in pain. You just have to stretch your hand, just hold any wall and stand there for a minute. So dropping is not an excuse at all. It is not a choice. We start for 1 minute, from 1 minute. Now 30 seconds is too less. 1 minute to whatever time you can give.
Very nice. So if anybody has any other questions, could you please speak up? Okay. So it appears that we are done with our question and answer session. So I would definitely like to say, Poojaji, that what you've shared with us today is actually a very nice development, I would say, of in-depth research done for the practice of yoga. And very nicely put, yoga is not just about asanas. That probably is the first step. It really ultimately leads one to self-realization. Practices that help one towards self-realization and personal growth, which is what the universal dharma is all about, regardless of denomination, purpose of life. So thank you for putting us in touch with this aspect. And also, I think what you've shared today was really very useful for many of us, because regular yoga classes and even many of this fancy new hot yoga or whatever, evolve yoga, whatever it may be called, does not actually give the people who probably most need the beneficial healing aspects of yoga access to that healing. Because many times we go through asanas that are very general and they might not address specific weak areas. I think our approach definitely does, and it could be a breakthrough for those. Even for me, I mean, though I've been practicing yoga on and off, if I were to access certain weak asanas, if I were to access a breakthrough there, I'm very sure that the other asanas also will give me the maximum benefit. I can hold the asana.
Holding the asanas, you please try. I'm telling you, just try one asana to hold for a minute. Just Do it comfortably. So asanas, the stage is a comfortable discomfort. You stay with that comfortable discomfort and stay there for a minute and experience how your breath is regulated in that. You should learn to regulate your breath in that position for a minute.
In fact, I'm wondering, it may be a good idea for us to have a workshop at the school with your unusual approach.
Yeah, we can do that.
Yeah,
It will
2
be
days.
helpful. Yes.
So maybe Swati could probably look into that at some future date. But it was very enlightening, and I think it opens another door to healing for many of us here, which could lead us to something much bigger in our personal growth as well, personal spiritual growth as well. So
I
thank you.
really wish that people stop making excuses for not doing yoga. I'm so particular about it.
Well, I can see the passion in your voice. I believe that you should connect the dots. When you say don't make excuses, if you connect it with what happens when a person does it properly. And like I remember a small snippet, just to share, it might give you an idea. Recently that I saw about exercise, it gave a very specific timeline. It said, if this is an incentive for you to exercise every day, and for gymming, for example.
Yeah.
And within 2 weeks, you will find that your strength has improved. Within 1 month, you will start noticing changes within your body and perhaps mind as well. Within 2 months, your immediate family members will notice a change. Within 3 months to 4 months, others will start noticing a change, and within 6 months, people will start asking you what you have done.
Wow.
So,
That's very nicely put.
yes, what have you done? Guide me. So you see, in this manner, if you just juxtapose this into your system, such clear goals will start giving people that connect between starting off and the consistent practice part of it.
Yes.
And I know that this is something that we all need to really explore. Being the birthplace of yoga, Bharat should take it forward and spread it to the world in this manner, not just Hatha Yoga.
Yeah. It is really more holistic and it is not a showstopper. I mean, it can help you overcome your day-to-day hindrances in the practice.
Yes, I think it'll give us a wholly more healthy population if it's done like that.
Yeah.
So thank you for giving us all these. See, these ideas just sprung up from the way you presented the presentation, and these are very powerful ideas. I really do hope that you and maybe all of us take it forward in some way or other. So thank you for opening up that new window of opportunity for all of us too, and inspiring us.
Thank you very much for giving me that opportunity. I'm glad I contacted Swati and she gave me an option to come here for the satsang and talk about it.
Most
I
welcome.
just want to answer Mr. Vijay about the knee strengthening position. So please don't Google it. If I'm not answering here, because Google will give you Birpadrasana or something else for knee strengthening. That is not for knee strengthening if you're having pain. So we have to start with lying down positions for quadriceps strengthening. You can call me later if you really want to know how it is done, but please don't Google it.
Thank you for the alert as well, Pooja ji.
Yeah.
So I believe now we
Thank you so much, Pooja ji. It was really nice. Thanks, Ramesh. And
Most
thanks, Swati, also.
Thank you,
for this.
Sajani ma'am.
Thank you for educating me. Thank you. I do yoga, but I'd never looked at the medicinal value of it. Thankfully, I've not needed it so far.
Thank you. God bless you.
So on
Thanks.
that note, yes. On that note of gratitude on behalf of the School of Ancient Wisdom, thank you so much, Pooja ji. And we would definitely love to have a workshop with you at the school sometime in the future. Looking forward.
Thank you. Thank you, everybody.
And on that note, we bring the satsang today to a close. But please do bring your friends along for the Spiral of Wisdom, which happens every Thursday between 6:30 and 8:30. Thank you.
Thank you. Bye-bye.
Hare Krishna.
Thank you. Bye.